Thank you for coming here. Good morning to everyone. Again, I do want to start off by thanking our first responders, everyone that's there on the front line, keeping things moving forward. And can't thank you enough to the doctors, nurses, and to all the administrators, and the janitors, and the maintenance people, everyone, administrative people, everyone that's out there that has to go to work every day so other people can stay home to stop the spread. And that's the most important thing. You've seen on the news last night, kids still aren't taking this serious. They're going out and playing basketball, they're playing tennis, they're playing soccer. I don't know what it's going to take for people to realize how serious of the situation we're in, what you need to make you realize. Does it have to be someone you love? Does it have to be a friend before you sit there and say, wow, we shouldn't be out? There's a reason why we keep emphasizing not to hang out in groups, to stay 6 feet apart, to cough into your arm, to wash your hands, is basically for your own protection and for the people around you that you love or don't love. But that's why we keep telling you this. And I gotta tell you, some days I go out and I'm like, hey, people are getting it. And then you go out another time and you're like, why are people walking around like there's nothing going on? Things changed. And we have to get used to the new norm, and we have to change with it. And again, that's why I tell people, take a step back, take a deep breath, and realize things around you are going to be different. But we have to act differently. And I know we're not a society that's used to doing that, but we have to change if we want to slow this down, if we want to make sure our hospitals can handle what they got going on and do this where they're not going to be overloaded. There's reasons why we're asking people to stay home, not just to give you a vacation to hang out at your house or go socialize or have a party in your yard or a party on your street block, or for your kids to run around like it's the summertime. Please, people, wake up. Wake up, enjoy the time with your kids, enjoy the time with your spouse or your husband and your girlfriend, your boyfriend, or your significant other. Enjoy that time. Or enjoy that time by yourself reading a good book. But do it by keeping social distance from everyone. As this coronavirus continues to go forward, in more and more cases, we're going to be putting out there, with testing, hopefully we're going to have testing solved within the next, either today or the next couple of days, that we can get back to testing and mapping and tracing, because the more we can identify where this is going, this covert, and I wanted to say covert because someone had a lot of fun yesterday with that, and you get a little tired and you say things, but I know it's COVID, but you get tired and you sometimes misspeak. So I will apologize on that, but I'm glad people are having fun with it. But in all seriousness, and this is a serious situation, and I hope people take this serious, that we're now up to 238 people. 238, and we have 401 people under mandatory quarantine and 202 people under precautionary quarantine. And yesterday, as you know, we had 228 positive cases. Today, yesterday we had 439 that were under mandatory. So that number drops, and it's going to drop. As people come out of the quarantine phase of 14 days, and that number changes. And yes, the people that keep asking the question, yes, we do have a lot of, do the math. After 14 days, they come off that number. The number we report is the number of cases that we've dealt with, the 238. But yes, there's not 238 people. Obviously, as you know, when we look at the mandatory quarantine, we don't have the people that have had the COVID-19 that are still positive, but they had it and they got over it. And like we said, most people are going to either have it, they don't realize they have it, or they're going to get, obviously they're going to get it and they're going to get through it. It's that vulnerable population that we talk about. People with underlying issues that Dr. Whalen's talked about, the people that have either lung problems or had lung issues or respiratory issues, that have underlying health issues. And unfortunately, that was the case with the 2 people that passed away this last week here in Albany County. And again, my condolences to the family, and my heart goes out to them. There are 27 people hospitalized. That's 11% of those who have tested positive. 12 adults still in the ICU. And as you all realize, we're entering the 4th week of this. 4 weeks of what's going on. And this is, again, going to happen for the next probably month or two, that you're going to see this going on. Everyone's extending kids staying at home from school, businesses closing down to the end of April now, non-essential employees and all that stuff. So that's going to continue. I also want to thank the businesses here in Albany County that have stepped up to the plate, especially the school districts. South Colony School District, Principal Jill Penn delivered a bunch of PPE today to the Department of Health. I can't thank South Colony School District and Principal Jill Penn for helping us out with that. So thank you again, and thank you to everyone that are donating stuff, because we are getting it out to the people that need it. I can't thank you enough. And with the federal stimulus package that was passed last week, two important things. Time-sensitive economic assistance programs for nonprofits and small businesses. The Paycheck Protection Program is $349 billion worth of loans for organizations with fewer than 500 workers to cover payroll and other qualifying costs. The loans become a grant if staff is kept on payroll during that loan period. It's a grant. So if you keep them on the payroll and you keep them through the period of the grant, you don't have to pay that money back. You can see the website that's up that you can click onto. Regeneron yesterday donated over 500,000 masks or test kits, to New York State, with more to come. I can't thank Regeneron enough for for taking care of that, and I personally want to thank them in this time of crisis that they are stepping up and they are doing it. So thank you. And they're going to Albany County too, to tell everyone here, we have tested over 3,704 people, right? So we do need to do more tests to understand the extent of the spread of this virus. And that's why Eliza and I and my whole department, and I can't thank Dan Lynch and Chris Quinn for everything that they're doing, and Luke, to try to make sure this testing gets back up and running. I'm hoping today we will have an announcement on that, or within the next couple of days. We know the importance of it, because it's here, and that's why we keep saying from day one, look what's going on in Italy. Liza said it perfectly, day 2 of our first press conference, that they're about 10 to 12 days behind us. And we know now, looking at the numbers, if we were still testing at that level we were 2 weeks ago, we probably have 500 cases. So think about that. And then you'd be identifying people that are walking around that are positive, but they're showing no signs or symptoms. That's why the CDC is looking to change its protocol about everyone wearing masks for that reason there. And we're still waiting on a guideline from the CDC on that. I want to thank the Ford Motor Company for making over 200 face shields that they will be delivering. They have delivered to some of New York, and they're giving it to California, but it's going to benefit Albany Med, St. Peter's Hospital, Albany Memorial. I know we're waiting on the shipment, but I can't thank the Ford Company enough. Again, companies that are the backbone of our communities that are obviously changing with the situation, this epidemic that we're in, and changing for the better of this community to get stuff out there that's going to protect people and protect the first responders that are on the front lines, keeping us safe. So God forbid if you get sick or a loved one gets sick, they're there to protect the person in the hospital, but also protect themselves. So when they go home to their families, they're not spreading it to their families. So we can't thank them enough. We've got a lot of questions on Facebook, and I got a lot of emails on this. What are when you talk about essential versus non-essential workers, what's the definition? That's a great question, because as this has been going on to the 4th week, we have people that like to identify themselves here in the county as non-essential employees, but we have essential employees that have to go to work every day. In 4 weeks, and I can tell you Department of Health, who's been going around the clock, and Liza and ourselves been going 7 days a week, they need relief. So we're moving workers that might deem themselves non-essential to essential to help give a little break to the people that have to come into work every day. Like I said before, the nursing home doesn't shut down, the jail doesn't shut down, road patrol doesn't stop, fire department doesn't stop, EMS doesn't stop, but they need relief. So I'm really looking at everyone as essential in the county workforce, but it's the governor who decides what sectors of the economy are essential and not essential. So we take the guidance from the governor. So it's a question we keep getting asked, and we get the answers when the governor's people put it out, what they deem essential and what they're not deemed non-essential. So I want to thank again everyone in our county workforce that's been out there, that continues to do their job. I can't thank you enough. I'm paying attention to what you're doing day in and day out. So, and to the people that are paying attention, that are out there staying home, not going out, not unless they're going to a doctor's appointment or going to pick up medication or going to the grocery store. Thank you. I appreciate that. The residents appreciate that. To the people that aren't, just go on YouTube. See what's going on in Italy. See what's going on in other countries. See what's going on in New York City. If that doesn't wake you up, I don't know what will. Other than a complete shutdown and curfew or fining people for having social parties, and that's what I'm looking at now, of looking to start fining people if they're going to have parties at their house like they're doing in New York City. We've gotten so many people that have responded in that obviously have issues with their neighbors having parties and not paying attention, because they're putting them, not just the people at that party at risk, but the people in the neighborhood at risk. So we will have to address that. I was hoping we weren't going to have to, but we're going to have to. The other thing that we're looking at is when I set up the price gouging with the District Attorney Soros and Sheriff Apple, we do have some, now unfortunately we're having some complaints going in that came into the 211. We'll be addressing that and sending that off to the District Attorney's office and to Sheriff's office to address them issues about people price gouging. It's not the time to take advantage of people. It's time to be a good neighbor. And if stores are out there doing this, we're going to make sure, again, we embarrass you, like the restaurants and bars that want to continue to serve people. And I can assure the public out there, everyone's calling us, letting us know. And it's not that they want to throw you in, but they're doing it to protect their community. They're trying to be responsible within their community, unlike everyone else that are not paying attention. Again, we always like to put up the number for our mental health. We keep getting a lot of calls, so please continue that coming in. I like to put that number out there all the time, 518-269-6634, 7 days a week, 8 a.m. to 5 p.m. And we always put up the hotline for New York State hotline and the 211. The 211 is just not for people calling in about people pointing out that people are price gouging. It's there to answer questions for you too. Questions you might have. And again, I'll say this, I can't answer any more questions on Facebook about all this phony stuff they put out there, people. Come on, it's 4 weeks into it. Stop believing everything that's on Facebook. Stop believing it. Go to, Dr. Whalen was saying yesterday, go to the Department of Health's website, go to the CDC, go to our website, go to a place that you can trust, go to the media's website, a place that you can trust to get the right information, go to the Times Union's webpage. Go where they're going to put the factual information out, not someone just putting something out on Facebook to either scare you or tell you there's a cure, or if you do this or if you buy this product. Trust me, if that stuff's out there, it's going to get out quick, and it's going to be probably announced on the national level versus someone saying I got a cure and this is what we're going to do. So please, the COVID-19's here. It's going to be around, and we're going to continue to address this and change the way we operate. The world around us has changed. That's why I tell everyone, take a deep breath, take a step back, reevaluate yourself, and remember what you do today, you'll be judged tomorrow. So 4 months from now, after this is over, when we kind of get back to the new way life's going to be for us, don't be that person saying I coulda, shoulda, woulda, I wish I acted differently, I wish I was a better neighbor. Be the good residents of this county that I know you are, and let's take care of one another. Dr. Whalen.
As the county executive said, overnight we got 10 additional cases, and this is, as you are all aware, with the continued limited testing that we have. So we know that we haven't got a true representation of what's going on in the community, and I would like to thank County Executive McCoy for being tireless in trying to ensure that we can reinstitute testing in a wide-scale basis in Albany County. I think there has been some movement on this, and we look forward to letting you know more about that in hopefully the very near future. I wanted to talk a little bit this morning about timeline. This is something that we're hearing so much about. The governor's press conference is talking about it. They're talking about it nationally. The date of April 16th has kind of been thrown about as when we might hit the apex of this. And I think that that's important for a couple of reasons. First of all, it gives us something to look at when we look at national data and the case representation and where we are starting to see the numbers potentially start to drop off. It's a good thing for all of us to look forward to. But it's also important to know that that means it's our midway point. So as we say every day, we're in this for the long haul, and it's important for people to be aware of that. We're heading into our nice weather, which is something that every year we look forward to. And every year when the weather hits, it's more common to see people out congregating in groups. It's what everyone wants to do. It's what feels natural to us. And we again want to caution about staying in out-of-group environments. It's essential so that we keep this timeline and we keep this curve where it needs to be, where we're protecting others. As the weather starts to get nicer, we're not discouraging people from being outside. We're just discouraging people from being in groups. So please be mindful when you're taking walks that you keep social distance away from others. Flattening the curve is as important to us today as it was at the beginning of this. It will continue to be as important as it is today, as it was yesterday, until we are well on the other side of this apex that's being discussed. So it's important for people not to get a false sense of security. With the availability of testing, we hope to get a better idea of what's going on in Albany County. We only now have good data on how it's affecting our hospitals. And I think that what we're hearing is that the hospitals at this point are not overburdened, and that's a good thing. We know that there is capacity to care for patients, and that's important. And we are monitoring that with them on a daily basis. To get an idea of how it's affecting the community and doing the widespread testing, as County Executive McCoy mentioned, gives us a better idea of those that are not requiring hospitalization, people that may have milder symptoms, people that may be at home with a low-grade fever and a cough and be wondering or be concerned about their symptoms. We are hoping that we will be able to be in a place where we can test those people in the very near future. So please keep your eye on this space. As we had indicated, this has been a problem in much of upstate New York, and in weekly and sometimes more often calls with the New York State Association of County Health Officials. We know that many of the upstate counties are doing exactly what we're trying to do and advocating to get those test supplies. This is happening simultaneous with a lot of commercial labs, private labs getting up and running. So we really think with these joint enterprises being launched, we will be able to be testing more people in a very short period of time. We are also looking at state deployment of much needed PPE. There are sectors of the community that require PPE, and we're working on trying to make sure that we are protecting our most vulnerable people. This is something that's incredibly important. Our nursing home residents, our adults with disabilities, those that are not able to protect themselves, we need to make sure that they are being protected. So we're working with various agencies to make sure that this is being done and to reassert the importance of this going forward. Our nurses and staff continue to work around the clock. We've been really lucky with some wonderful volunteers that have come to the department that are taking calls. And as County Executive McCoy said, our staff has been working very long hours to make sure that we're tracking down all the positive cases and identifying contacts and making sure those people are placed in appropriate quarantine so that we do not have spread. We know that people can spread COVID-19 before they develop symptoms, and this is a particular concern, and it's why identification of cases and quarantine of contacts is an essential part of pandemic response. Our staff is very committed to the work they do. People are working 12, 14, sometimes more hours a day. And we look forward to being able to work with additional county employees going forward that are going to be providing much needed relief to staff that have been working this way for weeks. We know that we can rely upon our co-workers from the county workforce to come in and be trained and to assist us, and we look forward to that. There's a lot of good that's going on, and I think we often talk about fear. We often talk about anxiety that this produces. There is so much that's going on currently that is not only unprecedented and historic, but it's frightening. So I would echo my colleague, Dr. Steve Giordano's urge to the public to be mindful of how you're taking care of yourself. Be mindful of how you are thinking about each moment and not trying to project too far down the road because this can cause anxiety. Being mindful, being aware of the moment is all any of us have right now. And that is a knowledge that sometimes is difficult to process, but it's something that we all need to take consideration of. Those of you that are home, I know it's difficult. I know it's difficult to be cooped up with family, but it's necessary. And we can all try to do what we can with the moment that we have and continue to move forward day by day with this. Thanks.